Ayun. So, recording na tayo, guys. So, let's begin with professionals within the clinical laboratory. Now, I'm going to discuss this topic based on the Philippine setting, and also I'm going to compare it with the setting in abroad. Kung paano ba ang setup ng mga clinical lab, ano ba yung mga trabaho ng mga professionals natin in the clinical lab here in the Philippines and also in abroad. Okay, so para meron kayong comparison. Because as we all know, karamihan naman talaga ng mga estudyante, they take a medical course such as Medtech or nursing para nga naman makatira sa Amerika. Because now, napakabilis makaalis class. Kapag ikaw ay Medtech na license, mag-take ka lang ng ESCP, napakaraming hiring sa Amerika. Okay? So we're going to see the difference between the Philippine setting and the international setting. So let's talk about the organizational chart. Okay? So in the Philippines kasi class, there are some hospitals that are still traditional na iisa lang yung may-ari. You have one hospital administrator. However, in Metro Manila, ang trend ngayon is mga kumpanya na ang may-ari ng mga ospital. Okay? For example, we have Manny Pangilinan. He is a billionaire, 'di ba? Meron siyang mga different hospitals in Metro Manila na siya ang may-ari. So kapag gano'n, na company ang may-ari ng ospital or isang malaking kumpanya, then definitely, after the hospital administrator, you have what you call the board of directors. 'Di ba? Yung board of directors na yon, together with the hospital administrator, they are the ones who makes decision for the welfare of the hospital. Kung paano ba papatakbuhin yung ospital. So depende pa rin yan, 'di ba? So kapag naman ikaw magtatrabaho ka sa government hospital, then of course, ang may-ari ng mga yan is government, 'di ba? Yung gobyerno may-ari niyan. And then, it is under the management of your LGU. Kung saan man yung lugar ng ospital na yan, it is being managed by the local government units. So, sila yung mga hospital administrator for that. Okay? And then after that, after the hospital administrator, you have the laboratory director, also known as the department head. Yung laboratory director in the Philippines are pathologists specialized in clinical laboratory science and certified by the Philippine Society of Pathologists. Okay? So, hindi basta-basta pwede ang pathologist or any doctor na mag-head ng isang laboratory. Kailangan certified ka ng Philippine Society of Pathologists. But sa ibang bansa, merong mga certification program din. Meron din mga licensure exam silang dapat kunin. Pero hindi lang siya limited sa pathologist. Pwede rin yung doctor na specializing in clinical laboratory science or yung mga doctor of osteopathy or even medical doctor. Okay? And then, in the Philippines, lahat meron talagang department head or laboratory director. This is mandatory. Okay? However, in the Philippines, sometimes you do not have an associate pathologist. May mga ospital na walang associate pato. Ano ba yung associate pathologist? Anong difference niya sa chief pathologist or sa laboratory director? Okay? So yung chief pathologist na yan or the lab director, siya yung pinaka-supervisor ng buong laboratory. So lahat ng kalakaran sa loob ng laboratory, siya yung final say. Siya yung nagmamanage dyan. Okay? However, per section in the lab, meron ding specific pathologist din who will examine the results. Each section of the laboratory. Di ba nga last week I have mentioned to you, the laboratory, they have several sections. Di ba? They have the clinical chemistry section, immunology section, hematology section, etc. So kada isang section na yon, meron yung kanya-kanyang pathologist din that will actually counter-check the results before they release it to the patient. So bago maglabas ng resulta, pinipirmahan mo na yan ng mga associate pathologist. So in the Philippines, yung mga malalaking ospital, yes, they have associate pathologist per section. Pero kadalasan, wala. Karamihan wala, class. Okay? Ganun sa Philippines. Now, after the associate pathologist, meron kang chief medtech. And you should also have a lab manager. Okay? Sa ibang bansa, talagang meron yan. Merong chief medtech tsaka lab manager. But in the Philippines, ano lang ang meron? We only have the chief medical technologist. Bihira ka makakita ng ospital na merong laboratory manager. So, ibig sabihin nun, in the Philippine setting, the chief medical technologist is working as a chief medtech plus as a laboratory manager. So, double duty ang chief medtech natin sa Philippines. So, gano'n tayo sa Philippine setting. Okay? Now, ano ba kasi ang difference sa kanilang trabaho? Bakit ba dapat magkahiwalay sila? Kasi class, ang lab manager, this is also a graduate of medical technology. Pero, meron siyang inaral din sa business side. Okay? So, marunong siya mag-manage in terms of the finances ng laboratory. The manager is the one who will make sure that the laboratory will really earn income. Okay? So, the lab manager is in charge of pricing for the testing of the for the pricing of the test. So, yung mga presyo, siya ang in charge diyan. Besides that, the lab manager is also in charge of staffing. When you say staffing, this is a process of hiring the medical technologists or hiring the staff needed in the laboratory and the proper allocation of staff. So, sino ba yung mga duty na Medtech in the morning, in the afternoon, and also in the night duty or the graveyard shift. So, lahat yon trabaho ng isang lab manager. Also about allocation of resources, yung mga laboratory supplies, yan. Siya yung kailangan mag-order ng supplies, ng mga gagamitin, mga reagent, chemicals, also yung mga machine, 'di ba? Basta may kinalaman sa mga resources and how to manage that, then that will be the laboratory manager. 'Yun ang kanyang trabaho talaga. However, ano ba talaga dapat ang trabaho ng isang chief medical technologist? Kapag chief medical technologist ka, ang trabaho mo is quality control. Okay? You are the general supervisor who will make sure that your medical technologist working in the laboratory is providing quality, accurate, and precise results. Okay? You are the one who will make sure of that. So how do you do that? Ang mga chief medtech, they go around each section. Okay? And in each section, the chief medtech will check the results of the quality control. Kasi class, kada isang section gumagawa yan ng mga testing for quality control. And then yung mga result ng testing na yun for quality control, that is being counter-checked by the chief medical technologist to double-check kung talaga ba yung mga machine is working properly or not. And also to double-check the people in the laboratory. 'Di ba? Kung tama ba yung kanilang ginagawang trabaho. Yun ang trabaho talaga ng chief medical technologist. Okay? So, dapat talaga hiwalay yan. But in the Philippines, double duty. 'Di ba? Yung chief medtech, quality control plus the finances of the lab. Siya rin yan all in one. Okay? Yon. And then after the lab manager, meron pa siya mga clerk, mga secretary that is in charge of mga clerical work lang, mga typing ng result, 'di ba? Dissemination of results, yan. Yan ang job ng mga clerk natin. Okay? Now, sa ibang lugar, sa ibang ospital, meron silang tinatawag na assistant chief medtech. Kasi nga, mabigat ang trabaho ng chief medtech eh. Yung analytical work na yan, na nag-check ka ng quality control, mabigat yan. Maraming computation yung class na ginagawa. Yung chief medtech mo, gumagawa yan ng mga chart, mga graph, pinaplot niya yan, nagko-compute siya, chinecheck niya yung data isa-isa. Kaya nga, kailangan niya pa ng assistant chief medtech. But in the Philippines, kadalasan walang assistant chief. Okay, kadalasan walang assistant chief. Ngayon, meron bang mga ospital sa Pilipinas na ideal na merong lab director, merong associate pato, merong chief medtech lab manager, tsaka assistant chief medtech, meron ba? Yes, meron naman, pero bilang lang talaga. Yung mga malalaking ospital lang na sikat ang meron. Yung mga ospital na pasado sa international accreditation. Kasi kapag nagpa-accredit sila ng JCI, yung international accreditation, hindi sila papasa kung hindi kompleto yung mga yan. Okay? Pero yung mga hindi nagpapa-accredit na basta-basta ospital lang, they can get away with it. Okay? Nawala yung mga ibang taong yan. Okay? So that is the Philippine setting ha. Yon. Tapos after the assistant chief medtech, meron ka pang section heads. Ito naman, sa lahat naman halos lahat naman ng ospital, meron talaga mga section head. Meron yan. So, ibig sabihin yan, kada isang section in the lab, meron ka pang supervisor. Okay? Yan. So, kada isang section, like the HEMA, merong head yan, microbio, clinical chem, blood bank, immuno, microscopy, histopath, lahat yan meron yang kanya-kanyang section head. Okay? So, anong trabaho ng mga section head? Yung section head is responsible to make sure that the results are being released on time. For example, sa hematology, ang hematology kasi class, ito yung section na tumatanggap ng test for CBC or complete blood count, di ba? For example, biglang dagsaan ang mga pasyente sa isang datingan, 500 specimen for CBC ang dumating. 'Di ba? Tapos yung Medtech sa Hima, kunyari, tatatlo lang kasi may nag-absent, 'di ba? Kaya kulang sila ng staff. So, yung section head, siya yung in charge to make sure na yung dalawang staff niya together with her will work efficiently, na matatapos yung 500 specimen na yon na hindi nasisira yung mga specimen. Kasi class, ang specimen talaga sa lab dapat talaga process immediately. Kasi kapag tumagal yan sa lamesa, nasisira yan. Okay? At hindi siya properly preserved, nasisira yan. Kaya nga naman yun ang goal eh. Makapag-release ka ng results on time and matapos yung trabaho on time. Because if you're going to let the specimen just sit there, it will spoil. And then the results will become affected. Nasisira din yung resulta nakuha. So, ganun ang work ng isang section head to make sure that the section is working efficiently. Okay? Efficiently and will release the result in a timely manner. Okay? Next is after the section head, andun na yung mga staff medtech, yung mga kasama ni section head do sa mga sections na yon. Yung staff medical technologist na yan, that is the person who is actually doing the test. Okay? Kung si section head, minamando niya yung mga tao, si staff medtech, siya mismo yung gumagawa ng mga inuutos ni section head. Okay? That is the staff medical technologist. So, staff medtech is a licensed professional, RMT yan, licensed or registered medical technologist. Now, after that will be the lab technician. Yung lab technician na yan, ito yung mga non-licensed medical technologists that will assist the staff medical technologists in the processing of specimen. So, yung trabaho ng laboratory technician, hindi siya pwedeng maging analytical. Yun ang difference kasi ng staff medic sa laboratory technician. Ang laboratory technician class, ginagawa niya lang yung process ng specimen. Processing ng specimen lang siya. But pagdating sa analytical testing, it is now the staff medical technologist. Okay? So kapag ipapasok na yung blood sa machine, kapag lumalabas na yung result sa machine, tinitignan ni Medtech yung mga resulta, analytical na yon. So dapat ang gagawa nun si staff medical technologist, hindi sa lab technician. Okay? Then ang pipirma din ng mga resulta should be the staff medical technologist. Never the lab tech. Now, in the Philippines, meron bang mga lab tech sa mga ospital? Meron naman, pero hindi lahat class. How about the laboratory nurse? So para saan ba ang laboratory nurse na yan? So kung wala mang laboratory nurse, pwede ang phlebotomist kasi ginagamit sila sa blood bank or immunohematology section. 'Di ba class, sa blood bank, as we all know, kapag blood bank, andun yung mga blood donor, 'di ba? Nagdo-donate ng dugo. So hindi naman basta-basta na mag-donate na lang ng dugo na walang screening process. Kasi syempre, kailangan i-check up 'yan kung yung donor ba may HIV, 'di ba? May hepatitis ba yung donor? Meron ba siyang ano ba, chickenpox or meron ba siyang sakit, 'di ba? Kasi kapag may sakit yung donor, hindi yan pwedeng tanggapin. So the one who will screen the donors is actually the laboratory nurse. Kasi nurse siya, marunong siyang tumingin ng mga signs and symptoms na hindi natin alam. Okay? Yun ang difference ng training natin ng nurses tsaka ng mga medtech. Okay? Yun. So, kailangan talaga ng laboratory nurse for that purpose. However, in the Philippines, bihira ka makita ng laboratory nurse sa blood bank. Hindi lahat. Kung meron man, meron, pero hindi lahat ng ospital meron yan. So, sinong gumagawa ng trabaho ng laboratory nurse sa blood bank? Of course, si staff medical technologist. Okay? So, natututo si staff medic na mag-take ng blood pressure, mag-check ng pulse rate, ng respiratory rate, di ba? And also ano pa ba? Mag-check ng physical appearance, ng signs and symptoms. Bigla na lang natututo sa ospital si staff medic. Okay? So, yun yung nangyayari sa Philippines. Hindi lahat ng hospital merong laboratory nurse. Yung ibang ospital naman, meron silang phlebotomist for that. Kapag phlebotomist, ang ginagawa lang talaga, mag-extract ng mga blood sample. So, si phlebotomist, umaakit siya pumupunta siya sa mga ward, umaakyat siya sa mga room ng mga pasyente, kinukuha na niya ng dugo yung mga pasyente. Si phlebotomist din, pumupunta siya sa outpatient department para kumuha ng blood sample and also sa ER para kumuha ng mga blood sample. Yun ang work ng phlebotomist. But in the Philippines, sino gumagawa nun lahat? Si staff medical technologist. So napakaraming trabaho, di ba, ni staff medtech. Siya na ngayon nagpo-process ng specimen, siya pa yung gumagawa ng analytical test, siya pa rin yung nag-screen ng blood donor, siya pa rin yung kumukuha ng mga blood sample. So that is the Philippine setting. Kaya nga sinasabi ko sa inyo, go abroad. Kasi kapag nag-abroad kayo, ang trabaho nyo doon, maghintay ng specimen. Kasi meron talagang phlebotomist na assigned to collect the blood. Okay? Meron talaga. So, kapag ikaw ay staff Medtech sa ibang bansa, maghihintay ka nila ng specimen tapos meron ka pang mga assistant. Hindi ka mahihirapan doon. Okay? And then of course, after that is the lab aid. When you say lab aid, ito yung mga staff in charge of cleaning the laboratory. Tagalinis sila ng lab. So after working in the laboratory, they will wipe your table, they will wipe clean your instruments sa mga ginamit mo. Kasi importante talaga sa lab ang disinfection class. That is very important, ang disinfection. Kapag hindi malinis ang lab, kakalat yung sakit. Kayo mismo magkakasakit. Okay? Yan, meron pa silang lab aid. But in the Philippines, meron bang lab aid? Kadalasan walang lab aid. Okay, kadalasan wala. Sinong gumagawa ng paglilinis ng lab? Si staff medical technologist. Ayan, di ba? Dahil mong ginagawa, maglilinis ka pa. Ganon, ha? So that is the Philippine setting. That is the reality. Now, there are some hospital na meron yan lahat na masarap magtrabaho. Yung mga sikat na ospital sa Metro Manila na malalaki. Hindi ko napapangalanan. Pero sila lang kasi yung mga accredited ng international accreditations. Kaya lahat yang kompleto sila, ha? If you will have a chance to work in those laboratory, then much better kasi medyo magaan ang trabaho. So, for the lab director, so this is the description of the lab director. Sino ba ang mga pwede maging lab director? So, ang nakalagay dito sa PowerPoint nyo, in general to kasi applicable din siya sa ibang bansa. But in the Philippines, pathologist lang talaga, certified by the Philippine Society of Pathology. Now, besides that, pwede rin ang medical doctors, doctoral scientists, doctor of osteopathy. So, they have ultimate responsibility for all laboratory operations. So, that is the work of the laboratory director. Now, for the lab manager, also known as the chief medtech, di ba? So, kung makikita nyo dyan yung definition niya, combination ng work ng isang chief medtech and also ng lab manager. Siya rin yung nakalagay dito ng meron dito nakalagay na quality control. Ayun. Evaluation of procedures, monitoring manuals containing instructions for every procedure. Yan. Quality control. Yan. Kasi nga, in the Philippines kasi kapag chief medtech ka, considered ka rin as lab manager. Pero sa ibang bansa, magkahiwalayan. Iba ang lab manager, iba rin ang chief medtech. Okay? So sabi nga dito, kapag manager ka or chief medtech ka, you are someone educated in laboratory sciences with additional business or management training. And then you are responsible for the day-to-day operation of the laboratory, responsible for setting personnel standard. When you say personnel standards, ito yung mga staffing. Ilan yung mga medtech na duty per day. Ikaw yung bahala dyan. So, paano bang allocation ng mga medtech na naka-duty? Actually, class, in the Philippines, it is based on the workload. So, for example, sa morning shift, sa ospital, ang duty ng mga medtech dyan, nasa 50, 50 ha. Kapag malaki-malaki yung ospital, nasa 50 yan. Bakit? Kasi sa umaga, ang kanilang pasyente, they cater to the outpatient, they also cater to the inpatient, and they also cater to the emergency room. Kaya nga naman, 50 ang mga medtech kapag umaga, morning duty. Kapag afternoon na, from 50, bababa na yan sa 25, half na. Bakit? Kasi wala ka ng outpatient. Ang pasyente mo na lang yung mga admitted or inpatient plus yung nasa ER. Yun na lang pasyente mo. Tapos kapag gabi na, ang medtech mo dyan, 6 na lang ang duty. Kasi nga, wala yung outpatient mo, wala na. Yung inpatient mo, tulog na, di ba? Tulog na yung mga pasyente na admitted. Ang pasyente mo na lang yung nasa ER. Kaya kapag gabi, 6 na lang ang duty dyan, usually ha. So, ang responsible to allocate the number of staff, it should be the laboratory manager. Now, they also establish training and evaluation procedure. When you say training and evaluation procedure, you are checking if the medtech is still working properly. Kung tama pa ba yung ginagawa ng mga medtech. So, kung medyo kailangan ni medtech ng training, lagi siya nagkakamali, then dapat si laboratory manager should look for a training to enhance the skills of the medtech. And then, meron din tayong tinatawag na competency program wherein sa ospital, biglaan na lang nagkakaroon ng practical exam, di ba? Si Chief Medtech, magbibigay siya ng mga exam sa kanyang mga staff. Kunyari, bibigyan kanya ng microscopic slide. Yung slide na yon meron yung dugo. Tapos, you're going to process that blood and then you have to release the correct result. Yung resulta, nakakaalam yon yung chief medtech mo or yung lab manager mo. So, binibigyan kanya ng practical exam. Tinitingnan kanya kung marunong ka talagang mag-test ng mga laboratory test. Okay? Yun ang tinatawag na evaluation procedures. And also, appropriate quality control programs. When you say quality control, you're making sure that the results you're releasing is accurate and precise. And observe and document employee performance and competence. Okay? And you will also monitor the manuals containing instructions. Ano ba yung mga manual containing instructions na yan? So, ang tawag dyan is the standard operating procedure. So, yung mga ospital, yung mga lab sa ospital, lahat yan meron yung SOP or the standard operating procedure per test. For example, CBC. So, sa CBC, meron dyang manual. Step 1, this is what you're going to do. Step 2, step 3, step 4. Para siyang ano, parang sa school 'di ba na meron kang procedure sa experiment tapos number 1 ito yung gagawin, number 2 ito yung gagawin. Okay? So gano'n din sa ospital, meron ka ring mga standard operating procedure. Ito yung mga written document that will tell you how to perform the test. Yan. So ang responsible din doon is the laboratory manager or the chief medical technologist. That is in the Philippine setting. So you also have again the section head. Ang other name ng section head is department head or general supervisor. So they are responsible for the quantity and quality of work performed in the department. So sabi ko nga kanina, kapag maraming trabaho na dumarating or maraming specimen, the section head will make sure that the specimen will be processed immediately and then the results will be released immediately. And also, about the quality of work. Kasi kapag sobrang dami ng specimen, baka nagkakamali na yung mga medtech, 'di ba? Kaya nga naman dapat nakatingin si section head to make sure na hindi nagkakamali yung mga medtech sa kanyang trabaho. Okay? The section head is also responsible for training the employees and evaluating employee performance. Then after that is the staff medtech, also known as the bench technologist or testing personnel. So he is the one who actually performs the laboratory analysis. Now, for the lab tech or the med lab technician, they assist the med tech in the performance of the different laboratory assay. Na-discuss ko na to kanina class. And then, of course, meron ka laboratory nurse, di ba, or the phlebotomist that performs the blood extraction and the laboratory aide that cleans and maintain the equipment. Okay? Yun. So, ano bang qualifications ng medical technologist or CLS? So, in the Philippines, of course, dapat graduate ka and then nag-undergo ka ng clinical training. When you say specified clinical training, this is what you call the clinical internship. Okay? So, yung clinical internship nyo, pagdating nyo ng 4th year, you will be assigned to a hospital for 1 year, then you will undergo clinical training. Okay? Isang taon yun, nasa hospital ka class. You are training in the laboratory, ang tawag dyan ay clinical internship or OJT. Okay? Ngayon, meron naman tayong tinatawag na externship. Kasi dalawa yung clinical training yan eh. Merong clinical training habang ikaw ay nag-aaral pa. That is the internship. Now, after you graduate, after you're able to get the license, pasado ka na ng board exam, graduate ka na, you have a choice if you still want to undergo what they called externship. Kapag externship class, clinical training din yon. However, graduate ka na, hindi ka na affiliated sa school. Okay? So, that is a training on your own. It is your initiative. Kung feeling mo kulang pa yung internship mo, gusto mo muna mag-train bago ka magtrabaho sa ospital as a staff, then pwede naman. Ang tawag doon ay externship. But that is self-directed. Hindi na siya connected sa school. Okay? And then of course, do not forget, you must be able to pass the board exam. Yun ang mga requirements para maging registered, maging medical technologist or clinical laboratory scientist. So what are the qualities of a desirable medical laboratory professional? So these are the qualities. So I'm going to emphasize na lang yung mga importante. First is the physical stamina, 'di ba? Kasi nga naman, our work is also physical. You're moving all the time, okay? You are testing the specimen. Hindi ka naman pwedeng mag-test na nakaupo ka lang, 'di ba? You must move. Lalo na if you're going to if you are a phlebotomist and then in the Philippines kasi kapag medtech ka, phlebotomist ka rin. So pumupunta ka sa ER, akit babayan sa ward, sa taas, tapos baba ka sa lab, tapos baba ka uli sa ER. Kunwari yung ospital mo, 12 floors, 'di ba? So aakyat ka from 3rd floor hanggang sa 9th floor, hanggang sa 12th floor, 'di ba? Tapos bababa ka na naman. Babalik ka ng 3rd floor, tapos bababa ka ng ER sa second floor or first floor, 'di ba? So ganun siya, ganun ang trabaho. So dapat meron ka talagang physical stamina. And then of course, good eyesight. This is very important kasi we are using the microscope. And also, we are operating the machines. Kapag yung mga makina na yan, meron siyang mga problema, ikaw yung unang tumitingin dyan kung tama pa ba. So, dapat nakikita ng mata mo. Okay? Yung mga parte ng makina na yan. Another thing is the normal color vision. Importante to. Kasi class, there are some tests that are dependent to color reaction. Kunwari, ang positive result niya dapat kulay purple. Ang negative is kulay yellow. Ang positive is color red, negative is color green. Those are examples of tests that relies on color vision. So kapag ikaw color blind ka, medyo mahihirapan ka. Hindi ka pwedeng gumawa ng mga test na merong mga color. Pwede ka ba bang mag-medtech kapag color blind ka? Pwede naman. However, kapag yung mga test na ginagawa mo relies on color, hindi ka pwedeng gumawa nun. You should tell your chief medtech na, "Ma'am, sir, color blind po ako. Hindi ko po makita yung positive tsaka negative dito." Okay? Para ibang medtech yung titingin. And also good intellect. This is very important kasi your work is analytical, di ba? You must be able to recognize if the result is correct or wrong. Okay? And then communication skills. This is also very important because you have to communicate well with your patient. Because the patients, of course, they are going to ask questions, di ba, on what you're going to do with them. Hindi naman po pwede na bigla ka na lang lapit sa pasyente, tinusukan mo. Di ka man lang nagsalita, wala ka man lang sinasabi, di ba? Hindi nagulat yung pasyente. Ba't mo ko tinutusukan, di ba? So, kailangan mo talagang makipag-usap mo na you have to talk to the patient. You have to introduce yourself, explain to the patient what you're going to do. If the patient will ask questions, you have to answer the questions properly. Okay? Para walang reklamo ang mga pasyente sa'yo. Now, another thing is, yan, for the ethics and professionalism, so sa ibang bansa, they have the ESMT and the ASCLS for that. In the Philippines, you have the PAMET and the PRC. So, na-discuss ko na to last time, di ba? Na kapag meron ka mga fellow medtech na lumalabag sa Code of Ethics, you can report them to the Ethics Committee ng PRC or sa PAMET para mawalan sila ng lisensya. Next is the privacy and confidentiality, of course. So, meron tayong tinatawag na need to know basis. Ito, need to know. So, sino lang ba ang pwedeng makaalam ng resulta ng pasyente? O, kunwari yung pasyente mo admitted, nasa ospital, di ba? Sino lang pwedeng makahawak ng resulta niya? Kung admitted yan, pwede mong ibigay yung result sa nurse station. Okay? Bakit sa nurse station? Kasi yung mga nurses, syempre, kailangan din na tignan yung resulta, sila nag-aalaga di ba? Another thing is, sa nurse station, nandun yung mga doktor. Doon dadaan yung mga doktor. Okay? Natitingin sa pasyente. Kaya nga talaga, kapag admitted, sa nurse station talaga yung resulta. Yun ang tinatawag na need to know. Kailangan pa bang malaman yan sa ibang section, sa ibang department ng ospital? Hindi na, di ba? Hindi na kailangan pang malaman yan sa canteen. Hindi na kailangan pang malaman yan doon sa maintenance. Kasi hindi naman sila related doon sa pasyente. Ano bang kailangan nila sa resulta. So, dapat yung mga need to know basis lang, yung mga nurses, yung mga doctors, sila lang dapat nakakaalam ng resulta. Ngayon, kapag naman outpatient yan, then dapat talaga yung pasyente mismo ang kukuha ng result. Kung wala man yung pasyente, let's say bedridden yung pasyente, nasa bahay, pwede naman yung relative, basta mayroong valid ID, pwede yun. Okay? And then, the test result should not be discussed with the patients. So, meron mga pasyente na gusto nila makatipid. Kasi nga naman, kapag pupunta ka sa doktor, ang bayad sa doktor dito sa Metro Manila, ang bayad sa kanila, nasa 1,500 na kada isang bisita. Yun. So, kung pupunta sila sa doktor nila, gagasos pa sila ng 1,000, di ba? Kaya ang gusto nila, itatanong sa Medtech kung ano ba yung ibig sabihin ng resulta nila. So, you are not allowed to do that. Ang allowed lang talaga mag-discuss ng results sa pasyente are the medical doctors. Okay? So, you can tell the patient na we are not allowed to do that. You have to go to your doctor. Kapag inaway ka, hayaan mo na lang, iwanan mo na lang siya, magpasensya ka na lang kasi hindi mo talaga siya pwedeng gawin. Okay? Now, test results should be reported only to the physician and other appropriate designated employee. And then, the employee must be professional, courteous, and considerate of patients. Next is the clinical laboratory. Okay, so when you say clinical laboratory, this is a facility that perform chemical microscope examinations of various body fluids like blood and tissues. So, maraming types of clinical laboratory in the Philippines. Meron kasing classification yan, class. Okay? So, it can either be a non-hospital based or a freestanding lab or a hospital-based laboratory. Kapag hospital-based, ibig sabihin nun, nasa ospital siya. 'Di ba? Nasa ospital. Yung yung laboratory. Kapag freestanding, hindi siya sa loob ng ospital. So ito yung mga nandoon sa roadside, sa tabi ng kalsada na mga laboratory. Okay? Pwede rin ang laboratory sa mga clinic, sa mga veterinary office, physician office, and government agency and military institution. So, ano ba yung classification of a clinical lab? So, you can classify them based on ownership. So, it can be owned by the government or the private institution. Okay? And then for the classification by function, it can either be a clinical pathology or anatomic pathology. So makikita nyo, divided yung mga sections into two. Clinical patho or anatomic patho. Nangyayari lang ito, class, kapag malaking-malaki yung ospital. Kapag malaki yung ospital kasi, then definitely maraming sections in the laboratory. Pero kapag maliit lang yung ospital, hindi mo to makikita lahat. Usually, clinical pathology lang ang meron. Ito lang. Itong anatomic pathology, wala yan. Okay? So for the clinical pathology, the sections under the clinical are the chemistry, hema, immunohematology is also known as blood bank. Blood bank ang tawag dito, ha? Microbio, microscopy, endocrinology, mol bio, cytogenetics, toxicology, and TDM. So those are the section under the clinical pathology. Now for the anatomic pathology naman, you have the surgical pathology, immunohistopathology, cytology, autopsy, forensic pathology, and molecular pathology. So hindi normally nakikita ito sa ospital. Usually, wala siya sa mga maliliit. Pero sa mga malalaking ospital, meron. Okay? So again, immunohematology, this is also known as the blood bank. Blood bank yan. Okay? Endocrinology, nakikita ito sa mga fertility clinic. Sila yung mga nagtetest ng mga hormones related to fertility. Molecular biology, dati hindi ito common, pero ngayon common na because of COVID. Halos lahat ng malalaking ospital meron ng molecular biology for PCR testing. Okay? Toxicology unit, so this is for poisons. Okay? Testing of blood sample for poisons or drugs. And also therapeutic drug monitoring. The therapeutic drug monitoring, these are for patients undergoing organ transplant. Kasi sila, yung mga pasyente na nakapag-organ transplant na, they are actually taking medications. They will take that medications for life. Kaya nga naman, you have to monitor kung okay pa ba yung treatment ng pasyente if the patient is still responding to that medication. Okay? Yun ang purpose of the therapeutic drug monitoring, for you to make sure that the drugs are still working for the patient. For the surgical pathology and the immunohistopathology, these are for cancer diagnosis, para to sa cancer testing. Ang cytology for cell analysis din yan. Autopsy, of course, para yan sa mga cadavers, di ba? Tinitingnan mo yung cause of death. For the forensic pathology, this is for investigation of crime. Pwede rin na cause of death for forensic pathology. Together with molecular pathology. Ito naman yung sa investigation of crime involving and using the DNA as a sample. Kaya tinawag siyang molecular pathology kasi nagtitest ka ng mga fingerprint, mga DNA dyan. Okay? So next is classification by institutional character. So it can be institutional based or the freestanding. Kapag institutional based, the laboratory is inside the hospital, the medical clinic, school, medical facility for overseas workers and seafarers, birthing home, psychiatric facility, drug rehabilitation center. So those are example of institution that may have a clinical laboratory. And of course, the other one is the freestanding, 'di ba? Yung hindi nakalagay sa ospital, yung nasa outside the hospital. Next is classification by service capacity. So meron kang tinatawag na General Clinical Laboratory. So under the General Clinical Laboratory, classify siya into 3. You have the primary, secondary, and the tertiary lab. Kapag primary lab class, minimum lang talaga ang kanilang service. Ito lang ang kanilang test. Napaka-konti lang. Ito lang talaga yung mga for emergency purposes na testing. So usually kapag primary category, ito yung mga laboratory na malapit sa ER, yan, or yung mga laboratory na freestanding din, na common lang ang mga test na ginagawa. Okay? Tulad ng CBC, yan. The routine hematology is the CBC. Mga CBC test yung mga yan. Qualitative platelet determination. When you say qualitative platelet determination, you're just going to report if the platelet is normal or elevated or low. So, pwede mong sabihin na platelet is increase, decrease, normal. Okay? Ganun lang ang qualitative platelet kasi qualitative lang talaga. Now, for the routine, urinalysis, routine fecalysis, and also blood typing. So, those are the tests under the primary category. Okay? So, hindi sila, so, routine work lang for emergency purposes lang yung mga testing niya. Ngayon, pagdating ng secondary category naman, ang meron dyan, lahat ng nasa primary, lahat ng mga test na yan, plus, ito yung dadagdag mo, the routine clinical chem, quantitative platelet determination. So when you say quantitative, you are now actually counting the platelets. So ang reporting dyan is, kunyari, 100, 150, 300, 400, yan. Yun ang reporting kapag quantitative platelet. Kanina kasi, quantitative platelet, di ba? So ang reporting mo lang is normal, increase, or decreased. Ganun lang. Pero dito, sa quantitative, binibilang mo talaga. You're counting the platelets. So numerical ang reporting mo dito. For the routine clinical chemistry, example of the tests are the glucose, BUN, uric acid, creatinine, and total cholesterol. Okay? So those are example of the routine clinical chemistry. Now, you have the cross-matching na. Kasi this is usually hospital-based. Hospital-based na yan kapag secondary. And then gram stain, this is also for hospital-based laboratory and also KOH for hospital-based laboratory. Itong dalawang test na yan, gram staining and KOH, these are stains being used to visualize your microorganism. So yung mga bacteria, yung mga fungi, pinapatakan mo yan ng mga stain tulad ng gram stain and potassium hydroxide para makita mo siya under the microscope. Okay? So this is the secondary category, laboratory. Now next, after the secondary will be the tertiary. So yung mga tertiary category na yan, those are the features from the primary to the secondary plus the following. Meron na siyang dagdag na special chemistry, special hematology, ito yung mga coagulation procedure. Ano ba yung special chemistry? Yung mga test na wala doon sa secondary. Okay, ito. Ito kasi mga routine eh. So kapag meron ka pang other test na under sa chemistry na wala doon sa routine, special chemistry ang tawag doon. Okay? Special hematology, meron ka ng coagulation test. Immunology, ito yung mga antigen antibody testing natin, 'di ba? Tulad na lang ng test for COVID antigen, 'di ba? Also for HIV and hepatitis. Now, microbiology, this is for culture and sensitivity. When you say culture and sensitivity, culture, it means that you are going to grow the bacteria. So, yung bacteria, papatubuin mo sa laboratory. And then, sensitivity, you're going to detect what antibiotic will kill the bacteria. Pagkatapos mo na patubuin, itetest mo siya sa mga antibiotic para makita mo kung ano ba yung effective para sa pasyente. Kasi kailangan kasi class yung antibiotic, dapat mapatay niya yung bacteria. So you're testing the different antibiotics if it is able to kill the bacteria. So yun ang trabaho sa microbiology. So meron tayong aerobic and anaerobic culture, both for hospital-based and non-hospital-based. Kapag aerobic, ibig sabihin noon, yung mga bacteria, these are the bacteria that requires oxygen for growth. For anaerobic culture, these are bacteria that require CO2 or carbon dioxide for growth. Okay? So those are the services under the microbiology. Now, you also have the limited service capability. Kapag limited service capability, institution-based lang siya. So kung ano lang yung kailangan sa institution na yun lang ang mga test na meron. For example, dialysis center. Ano na ba ang kailangan sa dialysis center? Ang kailangan lang dyan is BUN, creatinine, CBC. Yun ang mga kailangan test sa dialysis centers. Okay? Kaya yun lang ang test na meron sila. Or example dyan, mga fertility clinic. Kapag fertility clinic, ano ba ang kailangan test? Kailangan ng sperm analysis. 'Di ba? Kailangan ng hormone analysis for fertility. So, yun lang ang mga test na meron sila. Kasi limited service capability nga. Depende yan sa institution kung yung mga test na kailangan. Okay? Next is the special clinical laboratory. Offers highly specialized laboratory services that are usually not provided by a general clinical laboratory. So ano ba example dito? So nung bago ang COVID, 'di ba? Nung bago yung COVID, napaka matunog yung PCR testing, 'di ba? Pero dati kasi nung time na yun, hindi talaga normal ang PCR. Kaya lahat ng mga specimen dinadala siya sa RITM, 'di ba? Or the Research Institute for Tropical Medicine. Sila lang yung gumagawa ng mga PCR test. Kasi nga, specialized lab sila, specialized service. Pero ngayon, Ang dami ng gumagawa ng PCR kahit saan meron ng PCR test. Okay, so that is an example of a specialized laboratory services na sila lang ang meron noon sa Pilipinas. Actually, ang RITM, pati yung mga testing for viruses, meron sila dyan na wala sa mga testing sa mga ospital. Kasi specialized lab nga sila. That is an example of a special clinical laboratory. Meron siyang specific test na sa kanila lang present. Other types of clinical lab, again, so you have the limited service, special laboratory, such as the fertility, molecular cellular lab, mall bio lab, and research facilities, and also the NRL or the National Reference Laboratory. Itong mga NRL na to, these are laboratories designated by the Department of Health. So ano ba ang kanilang purpose? Number one, for confirmatory testing, di ba? For example, merong blood unit, di ba? Merong blood bag na dapat isasalin sa pasyente. Pero nung nag-test ka ng blood bag na yon, nakita mo HIV positive yung dugo, di ba? So definitely, hindi mo yun ibibigay sa pasyente. But sa Philippines, ang routine kasi, kapag may HIV positive kang blood bag, kailangan mong i-trace kung sino ba yung tao na nag-positive sa HIV kasi kailangan mong habulin yun eh. Kailangan mo siyang ma-inform na HIV positive siya. Now, before informing the donor, yung blood bag na yon, kailangan ipadala mo sa other institution to double check kung talaga ba na HIV positive yun. So usually, dinadala yan sa San Lazaro Hospital kasi andun yung SACL. Okay? Yun ang example of a National Reference Laboratory for confirmatory testing. That is just an example. For surveillance naman, example of this one is the RITM or the Research Institute for Tropical Medicine. So, what do they survey? Ano ba yung chine-check nila? Ang surveillance nila is the patterns of antibiotic resistance. Kasi nga naman, habang tumatagal yung mga bakterya, nagiging malakas sila. Hindi na nagiging effective yung mga antibiotics sa kanila. So, kailangan ng research para mag-develop ng bagong antibiotics. Kaya nga naman lahat ng mga data ng antibiotic testing sa mga ospital, kinukuha yan ng RITM. Gumagawa sila ng study about that and then pinapasa nila yan sa WHO, sa World Health Organization. Okay? So that's an example of a surveillance program na tinitingnan nila yung pattern of resistance sa antibiotic ng mga bacteria. Ngayon, kapag nakita ng based sa data ng RITM, kapag nag-collate yan ng worldwide data ng WHO, nakita nila na marami ng resistant, gagawa na sila ng research para baguhin yung mga antibiotic, para gumawa ng stronger antibiotic for that. Okay? Another thing is the resolution of conflicts, pwede rin. Training and research, kasi sila nga yung reference lab eh, sila yung mga expert. So, they can provide training and research programs. And also evaluation of kits and reagent. Kapag mga kits and reagent evaluation, ibig sabihin noon, ito yung mga bagong dating na mga test kits sa Pilipinas. 'Di ba dati, 'di ba, nung nagkaroon ng COVID, hindi agad-agad nagkaroon ng mga test kit. Naging issue yan na walang test kit, walang test kit. Kasi yung mga test kit are still being evaluated. Tinitingnan pa kung talaga bang working properly siya. Okay? Yon. So that is also one work of a NRL. And of course, EQUAS or External Quality Assessment Program. Ano ba yung External Quality Assessment Program? O for example, merong isang laboratory, they perform complete blood count or CBC. Gusto mong malaman kung yung CBC result mo ba is really accurate, kung talaga bang tama siya. One way to do that is to ask the National Reference Lab to test you. So ang gagawin ni NRL, magpapadala siya sa'yo ng blood sample. Si NRL, alam niya yung resulta niyan. Ang gagawin mo, itetest mo yung blood sample, dapat pareho kayo ng resulta. So kapag ang resulta mo, malayo sa resulta ni NRL, ibig sabihin noon, yung machine mo is not working properly. So yung mga resulta mo ng CBC, hindi siya tama. May mali sa laboratory mo. That is an example of a external quality assessment program wherein you're going to ask the NRL to provide you a specimen, then you're going to test the specimen in your laboratory, then you're going to check if you're going to get the same result. Okay? Next is the satellite testing site. So kapag satellite testing site, this is a smaller room, kunyari sa isang ospital, di ba? Meron kang main laboratory. Kasi malaki-malaki yung ospital mo eh. Meron ka talaga main laboratory dyan. Pero meron ka pa rin isang small laboratory near the ER. Para nga naman kapag emergency, madaling tumakbo yung Medtech kasi katabi lang eh. Katabi lang ng ER yung satellite lab mo, 'di ba? So, lahat ng mga ER doon sa satellite lab para mabilis ang resulta. Or pwede rin na besides sa satellite lab sa ER, meron ka pang lab sa OPD, sa outpatient, 'di ba? Para lahat ng outpatient doon na sa outpatient lab. So, ginagawa 'yan sa mga malalaking ospital. Para yung main lab mo naka-focus na lang siya for confirmation and for the inpatient. Okay, 'yun. So, that is example of a satellite testing site. So, any testing site that performs lab examination under the administrative control of a licensed lab but outside the physical confines of the institution's laboratory. Another thing is the mobile clinical laboratory. Kapag mobile clinical laboratory, ito yung mga mobile lab na nasa sasakyan, mga nasa van. So, ang purpose lang nila ay kumuha ng mga specimen. Pero tandaan nyo, kapag mobile clinic class, dapat meron siyang affiliated pa rin na laboratory na freestanding. Kasi ang sabi diyan, it shall only be allowed to operate within 1,100 kilometer radius from the main laboratory. Okay? So, ang ginagawa lang talaga nila is to collect specimen. That is the mobile clinical laboratory. So, let's go to the factors affecting the demand for health services in the Philippines. So, number one factor is income, di ba? Income. So, bakit kaya? Kasi class, in the Philippines, we live in a society na capitalist. Capitalist society tayo, class. Kaya nga naman, kapag capitalista ang society natin, society, ang main goal ng mga kapitalista ay magkaroon ng maximum profits. Kaya nga naman, if you're going to take a look sa setup ng mga laboratory natin, 'di ba nga sabi ko kanina, sa ibang bansa, meron kang staff medtech, meron ka pang lab 8, meron ka pang lab technician, meron ka pang nurse, meron ka ring phlebotomist, 'di ba? Pero in the Philippines, yung 5 na yon ang gumagawa iisang tao lang, 'di ba? Kasi nga naman ang goal kapag capitalist kasi maximum profits. Mas makakatipid kasi yung mga may-ari ng ospital sa pasweldo kapag iisang tao lang yung inutusan nila as compared sa maraming tao. Okay? Kasi nga naman mas malaki yung kanilang kikitaing pera because that is the goal of a capitalist society, maximum profit. However, ang nangyayari is yun nga, lumalaki yung kita ng mga may-ari ng ospital, but yung salary ng mga employee hindi siya tumataas. Kasi nga ang goal ng capitalist ay maximum profits. Malaki yung kita nila, pero yung mga employees na tinitipid nila. That is the Philippine setting. That is why in the Philippines talaga yung income natin mababa. Kasi nga capitalist ang ating society. As much as possible, dapat maliit lang talaga ang salary ng mga employee. Kaya nga naman sa Pilipinas talaga, if you really want to get rich, you can leave the country and work elsewhere, work abroad, or start a business. Gagawa ka ng negosyo. Kasi yung mga gumagawa ng negosyo, sila talaga yung kumikita ng malaki. Kasi nga, kapitalista ang Pilipinas. And then yung mga employees na normal, mababa lang talaga ang kita dyan. Okay? Sabi dito, higher families tend to have higher actual use of health services. So kapag daw mataas ang income mo, then definitely meron kang access talaga sa health services. So kapag mataas ang income mo, you will prefer to go to a private hospital, di ba, as compared to a government hospital. That is an example of an income. So, but since they can also afford preventive care, they are able to reduce their real need for health services. Kasi class, yung mga malalaking income, meron silang regular check-up. So kapag meron kang regular check-up, you're able to check or prevent yung mga adverse health effects mo pagdating sa pagtanda mo. Kaya nga naman, mas okay talaga kapag mataas ang income as compared sa mababa ang income. So for the price, yan, that is a negative effect on the demand for healthcare because as we all know, mahal ang patingin sa ospital. Bakit ganon? For example, ang urinalysis class. Ang urinalysis, ang puhunan mo dyan ha, siguro ngayon 20 pesos lang ang puhunan dyan. Kasi napakasimple lang ng urinalysis class, eh. Ang kailangan mo lang diyan, microscopic slide, microscope, yung centrifuge, nagkakain lang ng konting kuryente, plus yung Medtech na tinitipid naman nila yung sweldo. So, ang puhunan mo lang talaga diyan class, 20 pesos. Pero magkano ang singil sa urinalysis? Ang singil nila diyan 200, 300 pesos. Kasi nga capitalist ang ating society, maximum profits, okay? 'Yon. So, since mahal talaga ang mga health services sa Philippines, then definitely yung effect ng demand ng health services natin bumababa. Kung hanggang kaya pang tiisin, hindi mo na yan magpapatingin. Magpapatingin lang yan kapag malala na. Okay? So although total demand for healthcare was found in several studies to be not so responsive to price changes. Itong mga not so responsive to price changes na yan, applicable lang yan sa mga socialist society. Kasi kapag socialist yung government mo, ibig sabihin noon, yung access nila sa healthcare, libre. 'di ba? Tulad na lang ng Canada, ng ano pa ba yung mga socialist, Portugal, Denmark, France, 'yan. Libre, libre ang kanilang ano, patingin sa mga ospital. Kaya hindi nila pinoproblema 'yan, okey? Kaya nga naman they are not so responsive to price changes, okey? And the selection of the source of healthcare services will observed to be influenced by the price factor. But in the Philippines talaga, price is very important to us kasi nga capitalist tayo. So, mataas talaga ang cost of healthcare in the Philippines. Unlike sa mga socialist, kapag socialist countries kasi class, libre ang healthcare, eh. Wala kang babayaran doon. Okay? So, health insurance. In the Philippines, hindi lahat merong health insurance. Ang health insurance class, security mo yan eh, na kapag nagkasakit ka, meron kang meron pang bayad. And then, meron pa mga ibang health insurance that actually gives you an allowance. Kunyari, hindi ka nakapagtrabaho for 1 week because of your illness. Then the health insurance will be there to cover your salary. Meron din ganun na services. Okay? So it not only reduces the cost of care, it also increases the family's ability to secure health services. Therefore, health insurance is expected to raise the utilization and expenditure of healthcare. So health insurance is very important. Kung meron kayong access to health insurance, then very good. Might as well get it. Now, age. As we all know, habang tumatanda ang mga tao, mas madalas ang magkakaroon ng sakit. So sabi dito, yung mga children and elderly, they are the ones who are frequently going to the hospital. Sila yung laging merong illness. So as you grow older, mas lalo kang nagkakasakit, lalong tumataas ang gastos mo. Kaya nga naman habang bata ka pa, kailangan paghandaan mo yun. Kasi balang araw kapag matanda ka na, magkakasakit ka. So kailangan meron kang panggastos for that. Okay? Another thing is the gender, 'di ba? So gender, nag-influence din siya because of the lifestyle of the males versus the females. Sa Philippines kasi class, kapag lalaki ka, part na kasi ng Philippine culture 'yan, eh, na kapag lalaki daw dapat umiinom, dapat naninigarilyo, dapat macho. Gano'n daw ang lalaki kapag sa Pilipinas, okay? So that is why yung mga lalaki dito sa Pilipinas, sila yung nagkakasakit. Sila yung nagkakaroon ng sakit sa puso, nagkakaroon ng problema sa liver, 'yan, sa atay. Kasi nga because of vices. Sila yung maraming bisyo kaya sila rin yung maagang namamatay as compared sa mga babae. So, to isolate the effect of gender on demand, factors such as age, health status are considered in a model specification. However, attempts to do so yielded weaker result, only marginal differences in usage were detected. So, next is the family size. So for the family size naman, the bigger is your family, the bigger is your chance to go to the hospital kasi nga mas marami kayo, eh, marami kayo. And then in the Philippines naman kasi, kapag maraming anak tapos mahirap lang, affected din yung nutritional status ng mga bata. 'Di ba nakikita niyo sa mga TV, 'di ba, sa mga pinapalabas diyan na 10 ang anak, tapos yung kinakain nila kanin na may ano lang, na may sardinas, pinaghahati-hati pa nila, 'di ba? So, kapag gano'n, hindi proper yung nutrition ng mga bata, then definitely, yung mga bata, they will have illness, okay? Magkakaroon sila ng malnutrition. That's why they need more healthcare, okay? So, the effect of family size on the use of health services is unpredictable kasi it demands on the income pa rin of the family. Kapag malaki naman yung pamilya mo, 10 yung anak mo, 'di ba? Pero ikaw naman si ano, kunyari ikaw si Joel Cruz, yung may-ari nung afisyonado na bilyonaryo, 'di ba? Kahit marami kang anak, okey lang kasi bilyonaryo ka naman, eh, 'di ba? Marami kang pera na pangtustos doon sa healthcare needs of your children. Pero kapag mahirap ka, yun nga lang yung problema, nagkakasakit talaga yung mga bata. So, a large family has a higher frequency of illness since it has more potential patients. Kaya nga naman, ang number of children mo dapat proportional siya sa income mo. Kung ikaw mayaman ka, kaya mo mag-support ng 10 anak, go. Pero kung ikaw mahirap ka lang or middle class, tandaan niyo in the Philippines, ang middle class and poor, ang gap nila very ano lang, very thin lang ang kanilang gap. Ang middle class madali lang maging poor, okey, mabilis lang 'yan. So kung middle class ka or poor ka, dapat small lang yung family size mo. Kung ano lang yung kaya mong gastusan, yun lang dapat. Okay. Next is the education. For the education naman, example ng effect ng education tulad ngayon 'di ba, meron tayong COVID. So halos lahat na ng tao sa Pilipinas alam kung ano ang COVID. Alam mo yung mga sintomas na kapag nawalan ka daw ng panlasa, nawalan ka ng pang-amoy, meron kang ubo, meron kang fever, 'di ba? Lahat ng tao alam na 'yan. Paano 'yan nangyari? Because of education. Kasi nung time na 'yon na nagkaroon ng COVID, lumalabas sa TV, 'di ba? Meron silang mga information na nilalabas sa television, sa radyo, sa social media, kaya nagkaroon ng education yung mga tao. So that is the example, which is actually very important to prevent the spread of infection. Kasi at least alam nila na ganito ang COVID, nakukuha siya sa ganitong paraan. Kaya nga naman lahat ng tao naka-mask, 'di ba? Imagine kung walang health education, kung walang nangyaring education for COVID, edi lahat na, walang mask, lahat nagkaroon ng COVID, 'di ba? Gano'n yung mangyayari. So education, it means that greater amount of education may enable a person to recognize early symptoms of illness, resulting in the patient's greater willingness to seek early treatment. The patient spends more for preventive services and less for curative services. Tulad ng ngayon, 'di ba? We wear mask. We wear mask, we wear face shield. That is a preventive measure in order for us to prevent going to the hospital because of COVID. Okay? Now, health knowledge and beliefs. Ito, importante rin 'to sa Philippines kasi marami tayong mga paniniwala sa Pilipinas, 'di ba? Like yung mga albularyo, meron pa rin pumupunta sa albularyo, yung mga nagkakasakit daw dahil naengkanto, nanuno, ano pa ba, nakulam, 'yan, yung mga gano'ng paniniwala. So, kapag paniniwala na nakulam sila, saan sila pupunta? Sa mangkukulam din, sa albularyo, sa mga manggagamot. So, that is an example. Another thing ngayon, yung mga trending ngayon, yung mga diet, 'di ba? Yung mga vegan diet, 'yan. 'Yan ang mga trending naman ngayon na health na associated sa health natin, health knowledge and belief. So, an individual's health knowledge and belief affects his efficiency in maintaining personal health through dietary, hygienic, and preventive measures. Now, for the health need naman, so sabi dito is that demand for healthcare is based upon felt needs. So sabi diyan, kung hindi mo daw kailangan ng doktor, hindi ka magpupunta. So kung wala kang nararamdaman, hindi ka pa rin magpupunta. Okay? But sa ibang bansa talaga, dapat meron kang regular check-up. Kasi nga, tulad niya sa UK. Sa UK, meron silang mga regular check-up doon kasi walang bayad ang ospital doon eh. Meron silang NHS or National Health Services na kapag kailangan nila ng doktor, pupunta sila doon, libre. Wala silang binabayaran. Okay? Sa ibang bansa, yan, yung mga socialist countries, libre din ng healthcare dyan. So doctors assess whether felt needs are actual needs. Some turn out to be so. Self-perceived need determines whether or not individual is the market for healthcare. It is the immediate cause of decision to seek medical care. Ngayong class, depende rin kasi yan kung ang kailangan mo ba talaga is medical care or psychological care. Kasi minsan, there are some patients na yung kanilang nararamdaman na sintomas ay psychological pala. So, a doctor must be there to assess the patient. Kung ano ba yung sakit mo, is it pathological? Meron ka ba talagang sakit physically or mental ang sakit mo? So, kailangan pa rin talaga ng doctor's assessment for that. Okay? That is what you call the health need. Now, for the distance of source of healthcare, yan. Well, obviously, in the Philippines, diba, meron tayo mga areas na remote na kailangan mong bumaba ng bundok, kailangan tumawid ng ilog bago makapunta sa health center. So, ideally talaga, kada isang barangay dapat meron niyang health center. And then, kada isang municipality dapat merong government hospital. But in the Philippines, wala. Halos wala kang makitang government hospital, di ba? Kasi kung totoo yon na enough ang government hospital sa Philippines, dapat hindi mahaba ang pila sa JBL. Nasubukan niyo na ba ang magpatingin sa JBL kung gaano kahaba ang pila? Nasubukan niyo na ba sa PGH kung gaano kahaba ang pila, di ba? So napakahaba ng pila sa government hospital. Okay? Sobrang daming pasyente and then kulang din yung staff. Kasi nga, hindi enough ang mga health services in the Philippines. Kulang ang mga ospital natin. So that is why, if you're going to go abroad, either you go to America, United Kingdom, or find a socialist country para yung healthcare mo secure. Okay? Tulad ng yan, Canada, France, Denmark, Netherlands, yan. Maganda rin naman sa Netherlands, mga socialist country yung mga yan. Okay? Yun. So that is the lesson for this week. Do you have any questions regarding the topic? Any questions?